Most doctors are still telling patients over 60 to just go for a walk when they complain about back pain. And if that advice has ever frustrated you, if you've been walking regularly and your back still aches every single morning when you get out of bed, still stiffens up after sitting for an hour, still makes you think twice before bending down to pick something up, then I need you to stop what you're doing right now, because what I'm about to share with you in the next 20 minutes could genuinely change your life. Walking is not bad. Let me be clear about that. But for people over 60 dealing with specific back pain issues, walking alone is not enough. And in some cases, it can actually reinforce the very movement patterns that are making your back worse. Today we are talking about 5 science-backed exercises that clinical research shows are more effective at addressing the root causes of back pain in older adults than walking is. And we're going to explain exactly why that is, how each exercise works, how to do it correctly, and what mistakes to absolutely avoid. Before we get into the exercises themselves, we need to talk about why back pain in people over 60 is fundamentally different from back pain in younger adults, because this distinction is the entire reason why exercise selection matters so much. When you're in your 30s and you throw your back out, the problem is usually acute. A muscle got strained, a disc got irritated, and the solution is rest, some gentle movement and time. But when you're over 60, back pain is almost never just one thing. What's typically happening is a combination of 3 factors working together against you. First, there's muscular atrophy, the deep stabilizing muscles of the spine, particularly a muscle called the multifidus, and the entire group we refer to as the core, have weakened significantly due to decades of sedentary habits, previous injuries, or simply the natural aging process. Second, there's postural collapse. The hip flexors, which are the muscles at the front of your hips, have become chronically shortened from years of sitting, and this pulls the pelvis forward into what's called an anterior tilt, which compresses the lumbar vertebrae and puts enormous pressure on the lower back. Third, there's neurological disengagement. The communication between the brain and those deep spinal muscles begins to deteriorate, meaning even when you try to use your core, your body isn't recruiting those muscles efficiently. Walking does nothing meaningful to address any of these 3 underlying causes. It doesn't rebuild the multifidus, it doesn't correct the anterior pelvic tilt, and it doesn't retrain neuromuscular coordination. That's not a criticism of walking. Walking is wonderful for cardiovascular health, circulation, mental wellness, and joint mobility. But it is not a therapeutic intervention for back pain in older adults. These 5 exercises are. Let's go through them one by one, and I want you to take mental notes, or better yet, write these down, because the detail here is what makes the difference between doing an exercise and actually fixing something. The first exercise is the dead bug, and I want to spend a generous amount of time here because this is arguably the most important exercise on this entire list, and also the one most people do incorrectly. The dead bug was developed and popularized in physical therapy settings, specifically because it trains what's called spinal neutral, the position in which your spine is under the least mechanical stress, while simultaneously forcing the deep core muscles to engage against movement. Here's why that matters for back pain. When your back hurts, your body compensates. It recruits the big surface muscles, the ones you can see, like the rectus abdominis or the obliques, to do the stabilizing work that the deep muscles are supposed to be doing. This compensation feels fine in the short term, but those big muscles fatigue quickly and they pull on the spine in ways that create more compression, more pain, and more instability over time. The dead bug fixes this by making it impossible to cheat. To perform it correctly, you lie flat on your back on a firm surface. You bring both knees up so your hips and knees are at 90 degrees, like you're sitting in a chair that's been tipped backward. You raise both arms straight up toward the ceiling. Now, before you move a single limb, you have to establish spinal neutral. This means there should be a very slight natural curve in your lower back, not pressed flat into the floor, but not arched dramatically either. You can check this by sliding one hand underneath your lower back. You want to feel just enough space that your hand can slide under, but there's gentle pressure on it. Now take a breath in, and as you exhale, gently brace your core. Imagine someone is about to poke you in the stomach and you're tightening to protect yourself, but you're not sucking in. Simultaneously, very slowly lower your right arm back toward the floor behind your head while you extend your left leg away from you, lowering it toward the floor but not letting it touch. Hold that position for 2 to 3 seconds, then bring both limbs back to the starting position. Then switch, left arm back, right leg forward. That's one full repetition. Start with 5 on each side, rest for 60 seconds, and do 2 sets. The critical mistake people make is allowing the lower back to arch off the floor as they lower the opposite arm and leg. The moment that happens, you've lost spinal neutral, and the exercise stops being therapeutic. If you can't control the arch, modify by not lowering the limbs as far. You might only lower them 30 degrees at first. That's completely fine. The range of motion is irrelevant. The spinal control is everything. Research published in the Journal of Orthopedic and Sports Physical Therapy found that the dead bug activates the transversus abdominis, the deepest layer of the core, more effectively than nearly any other supine exercise, making it genuinely superior to walking for rebuilding the deep stabilizers responsible for back pain relief. The second exercise is the glute bridge, and this one is powerful for a very specific reason that is directly tied to the pelvic tilt problem we talked about earlier. When the hip flexors are tight and the pelvis is pulled forward, the glutes, your buttock muscles, become inhibited. This is a phenomenon called reciprocal inhibition, which essentially means that when one muscle is chronically shortened and active, the muscle on the opposite side of the joint shuts down. So tight hip flexors mean weak, underactive glutes. And here is why that's catastrophic for your back. The glutes are the primary movers of hip extension, and when they don't fire properly during activities like standing up, walking, or climbing stairs, the lower back muscles have to pick up the slack. Your lumbar erectors end up doing a job they were never designed to do repetitively, and over time they become overloaded, inflamed, and painful. The glute bridge directly targets this. To perform it, lie on your back with your knees bent and your feet flat on the floor, roughly hip width apart. Your heels should be about 12 to 16 inches from your glutes, close enough that when you lift up, you're driving through your heels, not through your toes. Place your arms flat beside you, palms down. Now here's the key cue that most tutorials skip. Before you lift, squeeze your glutes first. Not your abs, not your hamstrings, your glutes. Feel that contraction and then drive your hips up toward the ceiling, peeling your spine off the floor one vertebra at a time, starting from the tailbone. At the top of the movement, your body should form a straight diagonal line from your knees to your shoulders. Hold that position for 3 full seconds, continuing to actively squeeze the glutes, then lower yourself back down slowly, one vertebra at a time. That slow, controlled lowering is not optional. It's where a significant portion of the therapeutic benefit comes from, as it trains the eccentric control of the posterior chain. Perform 10 to 12 repetitions for 2 to 3 sets. As you get stronger over a couple of weeks, you can progress to a single leg variation by extending one leg while keeping the other foot planted and performing the bridge on one leg. This dramatically increases the demand on the glute medius, the side of the glute, which is critical for pelvic stability. A 2020 study in the Clinical Journal of Pain found that hip strengthening programs emphasizing glute activation reduced chronic low back pain scores by up to 49% in older adults over an 8-week period. That is not a small number. The third exercise is the bird dog, and this one is a favorite among spine rehab specialists for a reason that goes beyond simple muscle strengthening. The bird dog trains what's called proprioception, your body's awareness of its own position in space. As we age, proprioception declines. And this is enormously significant for back pain because your spine relies on constant sensory feedback to make micro adjustments to position and load in real time. When that feedback system degrades, Movements that should be smooth and controlled become jerky and uncoordinated, and those uncontrolled movements are exactly what leads to acute flare-ups and chronic irritation. The bird dog retrains that sensory feedback loop. To perform it, start on all fours with your hands directly under your shoulders and your knees directly under your hips. Your spine should be in a neutral position, no dramatic arch, no rounding. Think of balancing a glass of water on your lower back. Now, without rotating your hips or shifting your weight, slowly extend your right arm forward and your left leg backwards simultaneously. They should both be roughly parallel to the floor, not swinging up high. Hold for 3 to 5 seconds, actively thinking about lengthening through both the fingertips and the heel. Then return both limbs to the starting position with control, touching them down gently, and repeat on the opposite side. Perform 8 to 10 repetitions on each side for 2 sets. The most common errors are hip rotation, where the hip on the side of the lifted leg hikes up toward the ceiling, and compensating by letting the lower back sag or arch. Both of these errors eliminate the therapeutic benefit. If balance is an issue at first, try placing a yoga block or folded towel under the working knee before lifting to reduce the range of motion required. The bird dog has been cited in multiple systematic reviews as one of the most evidence-supported exercises for lumbar stabilization in older populations, specifically because it works the multifidus and erector spinae in their stabilizing capacity rather than their movement capacity, which is exactly what backs over 60 need. The fourth exercise is the seated lumbar flexion stretch. And before you tune out because the word stretch sounds passive, I need to explain why this specific stretch is clinically different from what most people do when they try to stretch their back. Most people with back pain either avoid bending forward entirely out of fear, or they stand up and reach for their toes, which puts enormous tensile force through already irritated spinal structures. The seated lumbar flexion stretch is safer, more controlled, and more effective because it uses the seated position to control the range of motion and unload the spine while still creating a therapeutic decompression through the lumbar discs and the facet joints. To perform it, sit at the edge of a firm chair with your feet flat on the floor and slightly wider than hip width. Sit tall, take a deep breath in, and as you exhale, slowly allow your entire trunk to fold forward, letting your hands slide down your shins or toward the floor between your feet. The key here is to allow the movement to happen passively. You're not pulling yourself down. You're simply releasing tension and letting gravity do the work as your spine gently rounds. Hold the bottom position for 20 to 30 seconds, breathing naturally. You should feel a gentle, diffuse release across the entire lower back, not a sharp, pinching sensation. If you feel anything sharp, stop immediately. As you return upright, use your hands to push against your thighs for support. Repeat this 3 to 4 times. The reason this works so well is that spinal flexion in a gravity-reduced position creates what's called negative intradiscal pressure in the posterior aspect of the disc space, which can help with both muscle spasm relief and disc-related pain. Research from the University of Waterloo's Spine Biomechanics Laboratory found that controlled lumbar flexion in a seated position produces significantly less compressive load than the same movement standing, making it an ideal decompression tool for adults over 60 who have some degree of disc degeneration. The fifth and final exercise is the hip flexor kneeling stretch, combined with a posterior pelvic tilt. And this is where we directly address the #1 postural driver of low back pain in older adults. We talked earlier about anterior pelvic tilt, the forward pull of tight hip flexors dragging the pelvis into a position that compresses the lumbar spine. If you do all 4 of the previous exercises but never correct this postural issue, you are essentially trying to stabilize a structure that is still sitting in the wrong position. It's like trying to fix a leaning wall without fixing the foundation. To perform this exercise, kneel on a soft surface. A folded yoga mat or a thick blanket works well, with one knee on the ground and one foot forward in a lunge-like position. Your front knee should be at roughly 90 degrees. Before you do anything else, perform a posterior pelvic tilt by tucking your tailbone under and gently squeezing the glute of the leg that is on the ground behind you. You should feel an immediate stretch at the very top of the front of the thigh of the back leg. That's the hip flexor engaging. Hold this tucked, squeeze position as you gently shift your weight slightly forward. Do not arch your lower back to get more range of motion. The tilt and the glute squeeze are the entire point. They neurologically inhibit the hip flexor, allowing it to release, while simultaneously training the glute to activate in its lengthened range. Hold for 30 to 45 seconds, then switch legs. Perform 2 repetitions on each side. For people who have trouble kneeling, this can be modified by standing in a split stance with one foot significantly behind the other and performing the same pelvic tilt. A landmark study in the journal Spine found that hip flexor tightness was present in over 85% of adults over 60 with chronic low back pain, and that targeted hip flexor lengthening combined with glute activation produced greater pain reduction than lumbar-focused interventions alone. Now, at this point, you might be wondering about the order in which to do these exercises and how often. Here's what the research and clinical practice both support. Perform these exercises as a circuit, in the order presented. Start with the dead bug to activate the deep core, move to the glute bridge to fire the posterior chain, then the bird dog to integrate spinal stability with limb movement, then the seated lumbar flexion to decompress the spine, and finish with the hip flexor stretch to reset your postural baseline. This sequence takes approximately 20 to 25 minutes and should be performed 3 to 4 times per week on non-consecutive days. You do not need any equipment, you do not need a gym membership, you need a mat, a chair, and the consistency to show up. In terms of progression, give yourself 2 weeks of performing each exercise at the basic level before adding any complexity or increasing repetitions. Back pain rehabilitation is not about pushing harder. It's about building a foundation of control before you build on top of it. There are also 2 things you absolutely must avoid while you're doing this program. First, never exercise through sharp, radiating, or shooting pain. A dull ache or mild muscle fatigue is expected and acceptable. Pain that shoots down your leg, pain that is sharp and localized in the spine, or pain that gets significantly worse during or after exercise is a signal that something is wrong and that you need to consult a physical therapist or your physician. Second, do not rush the repetitions. The temptation when exercises feel easy is to speed through them, but speed eliminates the neuromuscular benefit entirely. Every repetition should be slow, deliberate, and conscious. Think about the muscles you are trying to target with every single movement. And one more thing before we wrap up, let's talk about combining this program with walking, because the answer is yes, absolutely do both. Walking is still one of the most health-promoting activities a human being can do, and for back pain specifically, gentle daily walking helps maintain circulation to the spinal discs and prevents the kind of stiffness that comes from prolonged rest. The point was never to replace walking. The point was to give you the targeted therapeutic tools that walking simply cannot provide. Think of walking as your daily maintenance and these 5 exercises as your weekly repair and rebuilding work. Together, they create a comprehensive approach to back health that addresses both function and longevity. To bring everything together, if you are over 60 and dealing with persistent back pain, walking alone will not fix the underlying muscular weakness, postural dysfunction, and neuromuscular disengagement that are driving your symptoms. The 5 exercises we covered today, the dead bug, the glute bridge, the bird dog, the seated lumbar flexion stretch, and the hip flexor kneeling stretch with pelvic tilt, are each supported by clinical research and designed to address the specific mechanisms behind back pain in older adults that walking simply cannot reach. Do them consistently, do them correctly, and give your body 4 to 6 weeks of honest, patient effort before you judge the results. The science is on your side. If you found this information valuable, please make sure to subscribe to the channel so you never miss a video like this. Hit the like button to help more people over 60 find this content, and drop a comment below letting me know what health topic you want us to cover next, whether it's knee pain, balance, posture, or something else entirely. Your feedback shapes what we create, and this community is why we keep going. See you in the next one.